Hi everyone! Today I will talk to you about the differences and the similarities between block care, parent erasure, and filial trauma. None of them are diagnoses, but they're basically describing what happened to a parent when they're experiencing a lack of reciprocity between them and their child. And sometimes it's to the extreme of aggression from the child towards the parents. Sometimes we're talking about microaggression, which is basically difficult interactions that may happen every day, or maybe based on the attachment style of the child and the parent, it can become very difficult to have a relationship that's positive. And then we experience something that we call block care or parent erasure. And at its extreme form, we can talk about filial trauma. So we'll talk to you about block care as a start, and I will also show you a few resources if you want to read more about block care and what to do about it. So again, this video doesn't replace the therapy that you can receive from a community therapist, attachment and trauma therapist, someone who knows about the challenges of adopting a child who has attachment difficulties, developmental complex trauma, or a child with neurodiversity or something like fetal spectrum disorder or autism, and that you found like yourself in a position where it's difficult to care for your child. So this is only meant as being informative, and hopefully it helps you know better about your experience, maybe the experience of the family you're supporting, or simply understanding more about what it means for someone to have block care, filial trauma, or parent erasure. So block care is something that was developed by Dan Hughes, who created dyadic developmental psychotherapy. And if you want to learn more about block care, my favorite book is probably Brain-Based Parenting by Dan Hughes and Jonathan Balin. There's a big section on block care and the different kinds of them, but also what to do about this. This isn't specific to adoption, but this is still very good, and there's some section that takes into account that some of the children that we have in our family came to us through adoption or foster care. So this one is called Nurturing Attachment, and when your child has different challenges with attachment, this is really good in like understanding from a practical standpoint what you can do, and a little bit more about the child's experience. So when we understand the child experience better, it's easier to know what to do as a parent. So what is block care? And is block care permanent? So like I said at the beginning, block care is not a diagnosis. It simply describes the experience of someone, but also their neurobiology. So usually when you become a parent, let's say you give birth to a child, you will have a lot of hormones as the parent, usually the mother. You will have oxytocin, which is the attachment hormone. So without doing anything, your whole body is like, yeah, let's attach to this baby. And there's reciprocities between the baby and the parent. So for example, the baby is going to make sounds, maybe smile at you, look at you, and just their smell can really help you have attachment for this baby, develop attachment to this baby. So what happens in adoption, foster care, when the child is not able to reciprocate the relationship? Let's say you bring a meal to your child, you give them milk, you're trying to soothe them, and what you're receiving is actually not something that's positive. So for example, the child will hit back, scream at you, you won't be able to soothe the child, they blame you for something you haven't done. For example, the child gets hurt, the parent comes to the child, instead of being soothed by the parent, they will actually blame the parent for getting hurt. These are examples. And over time, instead of having oxytocin, the parent will have hormones that are stress related, like cortisol. So while the parent wants to be engaged towards the child. They want to take care of them, and usually they continue caring for the child. What they will experience within themselves is a lot of stress. They'll be like, basically approaching the child and being scared. Or, for example, their brain's going to be like, you know what, run for your life. And that's the experience of block care. For some parents, because themselves experience trauma as a child or difficulties with attachment, and it happens sometimes with adoption as well. And if this trauma has not been resolved, it's possible that it's more difficult for them to have a lack of reciprocity with their child. And this leads to a block care that's maybe harder to overcome. I never say that block care is permanent, because usually it's also like based on the trauma of the parent that they experience with that child. So if the child either is more able to engage in the relationship, or if the parent heals and has different expectations, then they may be okay with having a lack of reciprocity with their child and heal from the block care and actually have a positive experience when they're caring for the child, even when the child's not always able to be have that reciprocity, even when the child is not able to engage in a positive relationship. So, and that's briefly what it is. I'm not explaining everything about how this can be overcome. It's too much. But basically, block care is neurobiological. Instead of having attachment and happy hormones, we will have stress hormones, and our brain's like not liking it. And we still care for the child, like in a practical way, but our brain is not liking it, and our whole body can respond negatively to being with the child or caring for the child. There's a few tips that I usually do in therapy. One of the tips that I usually give is find something that you actually enjoy doing for your child. Is it relationship gestures? Is it just watching a movie with your child? Is it just watching them when they're sleeping? Is it just sitting with them in the car and you're having a good moment and it's quiet? And it's sometimes the parent is so traumatized about some of the situation that happens, they will need to be with someone else to be able to do that safely. I'm talking about emotional safety, but also physical safety at times when there's a really high level of AFCCA. So that's block care in a nutshell. And in the next video, I'll talk about filial trauma, and I will talk about parental erasure and what it looks like.